Live now, Chair.
Okay, thank you. Good morning, everybody, and welcome to the first meeting of Health and Wellbeing Board for the new council year. If I can run through, first of all, apologies for absence. I'm aware of apologies from Councillors Baines, Fenton, Glynn and Wilkinson, with Councillor Megan Swift substituting as a voting member for Councillor Wilkinson. I'm just aware I was about to go through the cabinet agenda from Monday night, which probably wouldn't be, probably got a few people a bit confused about today's meeting. So I'll now start with the right one. Okay. Fazana, I think, can you remind me of the apologies? I think, was it Sue Lewis from Together Housing? I think we had apologies from. Are there any more? Either Fazana or Mike? No.
Chair. That's it.
Okay, thank you. And just to confirm for members, following the council's annual meeting, Councillor Fenton Glynn has taken over the adult health and wellbeing portfolio from Councillor Metcalfe, so we'll be attending this meeting in future. Otherwise, just to confirm, the membership is as set out on the calling notice for the paper. Okay, item 2 is to remind members to declare any interest they may have for items on the agenda. Item 3, there are no confidential items, so no need to exclude, get my tongue around it, exclude press or public. Item 4, can we agree that the minutes of the meeting on the 4th of March are a correct record? Does anybody who's there have any issues with them? Okay, can I take those as agreed then? Thank you. Item 5, question time. Do we have any notice of any questions?
None, Chair. No.
No, people seem to have forgotten to us. They all go to the partnership board instead now. Okay. So, so item 6 then, take straight on to the Calderdale Local Outbreak Prevention and Management Plan, and report being circulated. But can I ask Debs to introduce this item?
Hi, yeah, thank you, Councillor Swift. So the local outbreak plan, we were required to have one publish one by the end of June last year, and we've updated it twice since then, and this is the most recent update. An update to the plan in April, was undertaken in April of this year, and obviously the situation with COVID changes very, very rapidly, so what we've done in the plan is set out the sort of the principles really that inform our approach to the response to COVID, to preventing transmission of COVID, and then also really supporting the first phase of the recovery, so that we learn to live with COVID to enable us to start to recover as well. So the plan also sets out the governance arrangements for our work to prevent and manage COVID transmission. It tells a little bit of the story of the pandemic so far, and also we have really started to use a very robust programme management approach to our work on the plan, and my colleague Georgina Owen has joined us today, who's overseeing the programme management approach to the delivery of the plan. We've also did some work in April to identify a number of scenarios that could happen in relation to COVID, and we brought together a large number of partners to work on those scenarios and work through what we would do in those different scenarios. I think we're in a couple of the scenarios now actually that we worked on, so scenarios that related to new variants, to increase case rates across the borough and to increase case rates in particular areas of the borough. And through those scenario plans, that's really been really useful in getting us on the front foot, because as you all know, the situation changes rapidly. And as part of the scenario planning, we've also developed, which is an appendix to the plan, we've also developed a communications plan based on those scenarios as well. So rather than say any more, Councillor Swift, I'm very happy to take any questions or comments on the plan.
Thanks very much, Debs. I mean, certainly, I thought the plan. I thought the first plan was pretty clear. I think this is even clearer, and I think the scenario work and also the comm sections were really useful and helpful as well. And as you said, we've been drawing on this over the past few days, few weeks as well. So, questions or comments? I will try and see raised hands or comments in chat, particularly if I put them up. Okay, particularly if I get the right thing up. Okay, so Tim, can I bring you in?
Yeah, thanks. Yeah, I'd just like to say how good I think it is. You know, the report is extremely helpful, really, really clear, and just in recent days, being immersed in thinking about what's coming next in terms of inquiries, I would just say to the board that I think this sort of report, the detail, the evidence base, stands us in really in a really good stead for any future inquiries. It's a really strong record of the action that we've taken, and I think should be commended. It's extremely helpful and informative, and really gives us a good base for when people come and ask, you know, what we did. So we should acknowledge that. I think it's really helpful.
Thanks very much, Tim. Not see anybody else want to comment specifically on the plan. Oh yeah, Stephen, Dr. Cleasby.
Thank you, Councillor Swift. Yeah, I just wondered, Debs, if you were getting enough support and collaboration with all the partners, you know, obviously from the Health and Wellbeing Board perspective. Are there any barriers, any obstacles to, you know, the plan, its development and its implementation, or any challenges around that?
It's a really good question. Councillor Swift, may I reply? I mean, I think the you know, the partners of partnership working in relation to our response to COVID has been phenomenal. And I've got an item a little bit later to talk about the health and wellbeing strategy, and you know, I was going to sort of make a point in that item really about the springboard, I guess, that our response to COVID has given us for a completely new way of working and a much more integrated way of working. But just if I could just reflect in answering the question on just the last week, because I mean, it's been incredibly inspiring that when our case rates in parts of Halifax have increased rapidly, really rapidly, and as you be aware, we've got a cluster of the Delta variant in the Upper Valley in Todmorden. And we were given the opportunity to do the extra testing and enhanced contact tracing to try and as a preventative measure really to try and contain the spread of both actually the Delta variant and actually the Alpha variant that was first identified in Kent. And I've been absolutely overwhelmed actually by the support and the response that we've had from partners in the voluntary and community sector, in our NHS partners, all right across the council as well, and our partners in the Department of Health and Social Care as well. It's been phenomenal that we've managed to set up a local testing system, you know, within a few days really, and you know, and that's been a real team effort. And I was going to save this story for later, but I'm just going to, if you'll indulge me, just a brief story. We've got a new acting consultant in public health started this week, Ken, and Georgina asked him a really good question yesterday. Said, "Oh, you're fresh eyes, you're new. You know, what are your reflections on the work in relation to COVID in Calderdale?" And he couldn't believe that we weren't the same team. That the people that were meeting every day to work on this weren't actually all part of the same team within the same organisation, and that we've got a testing lead working for Locala, infection control expertise from Locala as well, that we've got different parts of the council, our voluntary and community sector, everybody, our local our elected members as well involved. And he was really surprised that this wasn't a single team working for the same organisation, and I think that's a fantastic endorsement actually, Stephen, of how everybody's been contributing to this response.
Thanks, Debs. So I haven't put on this agenda, I mean, on previous ones, we've had sort of a general roundup and catch up, and we felt probably those discussions were already happening and didn't necessarily need to be here. But if there is anything about the current COVID position anybody wants to highlight, particularly that needs a partnership response or that want information on, I don't know if anybody wants to add anything. Or Debs, do you just want to remind us very quickly of where we are with numbers and how we compare with our neighbours and so on?
Yeah, very happy to do that, Councillor Swift. So, and the number of cases in Calderdale is increasing now, sort of day on day and week on week, and we sort of hit a low point in terms of our case rate the very end of April, and then we've had a very sort of a gradual increase in cases during May, very much what we expect to see in Calderdale. As restrictions are relaxed, we know that national lockdowns don't work as well for us as they do for perhaps other parts of the country, so we know that we have a higher underlying case rate, and then what happens is when restrictions are relaxed, more cases, you know, there's more opportunity for the virus to spread, and that's very much what we saw during May. What we saw more in the sort of second half of May was a cluster of cases of the Delta variant first identified in India. Particularly, and we have cases of that variant right across the borough, but we've got a particular cluster in the Todmorden area, and actually just on the most recent data I've been looking at this morning, some other parts of areas of the Upper Valley are starting to see cases as well. Obviously, case rates on their own aren't high number of cases at the moment aren't a bad thing necessarily, because we've got relatively low levels of older people testing positive, although we have had quite we are up to 10 people in the last 7 days who were over 60, whereas we were down to 1 in May. So we are seeing a slight increase in cases in older people. And obviously we've got the phenomenal uptake of the vaccination programme as well. What we know is that the Delta variant particularly, yes, 1 dose of the vaccine does offer protection, 2 doses offer a lot more protection. So it's really important that that people get both doses of the vaccine if we're going to if the vaccine is going to protect against that Delta variant. But what we also know is that when we have higher case rates, there's more opportunity for new variants to develop as well, and for those variants to spread. So we're in a race between the rollout of the vaccine and the development and spread of new variants of COVID. And that race is one that it feels like we're sort of neck and neck in at the moment. But I think there is a real risk with the very recent increases in case rates. We are going to, it looks like we will go over 70 per 100,000 in the coming days. At the end of April, we were at about 24 per 100,000. So just to give you a sense of what's happening. So our colleagues in our NHS and our particularly primary care colleagues working so hard to make sure that we get everybody vaccinated, because that's what's going to enable us to continue to get our freedoms and keep our freedoms as well.
Thanks, Debs. Debs, I just thought it was useful to have that overview. So I'm not seeing anybody else indicating. So can I just check for me that we're happy to endorse the outbreak prevention plan and the associated documents? Thank you. I'm seeing a good array of nods. So thank you very much, everybody. And means we gain some time for the next item, which is really helpful. So the next item is a piece of work that was carried out by a subgroup from the Place Scrutiny panel looking at economic inequalities arising from COVID. Reports been tabled by Mike. We've got Councillor Roisin Kavanagh who led that piece of work for the scrutiny panel to present on it here. So I'll hand over to you, Roisin.
Thank you. Fazana, am I able to share my screen?
You should be. Let me just check.
I am going to just use PowerPoint, and it's about, I'm just going to pre-warn, it's about 10 to 12 minutes. And I think some of you might have seen this before, so apologies for the people that have seen the presentation before. Great, thank you. I chaired the detailed review on economic inequalities in COVID-19, and where the review came from was based on the fact that we know lots of people in our communities have been impacted by COVID-19, but that some national reports talked about the fact that there were some particular groups that had faced a disproportionate impact in terms of their economic status. So what we wanted to do is to really gather the voices of those people to try and inform any plans for recovery going forward. So the people that we identified were women, young people, Black, Asian, minority, ethnic and refugee people, disabled people, and people in low income and insecure work. And obviously we wanted to take into account that some of those people within those groups would be experiencing an intersection of issues. So you might have a young Black disabled woman that is facing a specific economic situation based on the intersection of all the different parts of their identity. So that was what we were aiming to do, is to really gather the real live voices of people. And just to say, this is a cross-party piece of work by a group of councillors from all parties. We got a lot of support from scrutiny. And in terms of the methodology, we basically ran 17 focus groups. And they were people identified either through voluntary community sector organisations or people receiving support from different council services. And in terms of the questions that we asked, we focused on what has been the impact on education, training and employment, and also financial stability and plans for the future. So those were the kind of themes that we were looking at. And then we also had a separate questionnaire, which was around the health and stability of the voluntary community sector. And that was based on the fact that the voluntary community sector were supporting some of the most vulnerable groups. We wanted to see how they were in terms of their stability. And for the focus groups we run on Zoom, for people who couldn't do Zoom, we did individual telephone conversations. And then just to back up the piece of work, we had a survey that we distributed through social media, and we got 360 returns on that survey. And the general approach of the focus groups and the conversations was around, this is a safe space. So we want you to feel safe to kind of talk, because obviously it's a very sensitive situation, talking about your financial situation. So what I'm going to do now is, because you've obviously got the full report, I'm just going to highlight some of the key findings. So probably most people know this, but COVID-19 was ridiculously expensive for some groups. So if we consider people living on a low income and the coping mechanisms that they have in order to stretch a really small budget really far, a lot of that was wiped out by COVID. So if we imagine people needed to buy PPE, they suddenly needed to get their shopping from supermarkets that delivered, which meant their food bills went up. They had to buy a minimum shopping in order to get the free delivery. They needed to get taxis instead of going on public transport. They needed to buy, some people felt like they needed to get things like vitamin tablets to keep their children safe, increased electricity and heating bills, increased digital costs. And all of this meant that the people on really low incomes suddenly weren't able to manage. So they might have been managing before COVID and suddenly not able. So someone said to us, we're trying to live more frugally, but despite efforts, the fact that I have to shield and have online deliveries has pushed up even my basic shopping bill by approximately £30 a week. So that was an experience talked about by all of the groups. The digital divide, which all of us know, was one of the biggest challenges during COVID. So this was a combination of people being able to access equipment, afford data, but also having the knowledge to be able to use that equipment. So the combination of those three things just led to a massive challenge for lots of people, either children accessing education, being able to access advice and guidance, being able to look for jobs, training opportunities, lots of different services suddenly people had to use online. So that combination really led to a lot of barriers for people. And that was particularly pronounced for people with additional challenges. So this quote here was from a refugee woman who was in one of the focus groups I ran, which she said, I've got 2 children, I've got 1 device, which is my phone. I can't afford more data, and I actually don't understand the instructions that have come from school. So just, you know, imagining parents trying to homeschool using their phone and then all of those other barriers. So huge issues for lots of people. Debt advice and relief, you know, what became apparent that I think we probably already knew, but was key to community support. So lots of organisations that were giving out food parcels, and some of these were new organisations that have never given out food parcels before, we're finding that actually when they questioned people who were coming for food, most people were saying, well, I can't afford to buy food because I'm servicing debt. And actually, for some people, what they really needed was some debt advice, or in some circumstances, advice on debt relief. And for some food banks, that they had the ability to refer to debt advice organisations. Some food banks that were just, you know, 150 people waiting outside, there was just no chance that they could do that additional work. But the big message that came out was, this is unsustainable to keep giving people food parcels when the actual underlying issue is people servicing debt. So what do we do to address that? A lot of people talked about dignity in terms of debt recovery processes, and what do we need to do in situations such as a global pandemic to make sure that the dignity of people is protected. So that might be from the first letter they receive to a bailiff coming out. What can we do to protect that? And then other people commented on the fact that it was very difficult for them to cope because they were on benefits, and creditors have got the right to take up to 30% of your benefits in order to pay back debt. So that just meant that it was absolutely impossible to be able to sustain their life costs. So lots of issues around debt advice. As we, I'm sure again know, there was a massive, unprecedented impact on young people. So the digital divide really impacted young people, but also the ability to find private space. So if you're living in a house that's cramped, you're sharing a bedroom, it was almost impossible for some young people to keep up their studies. The impacts of grades and what that meant for next steps. Lots of young people talked about the fact that all their volunteering and work experience disappeared, which was their only ability to get something on their CVs. Young people talked about apprenticeships and just disappearing because a lot of the companies that provided apprenticeships closed down. And then jobs that young people would normally do were mainly in the sectors that were called shutdown sectors. So things like working in cafes, bars, shops, that ability to work disappeared. For young people who are a little bit older and already in work, they talked about the fact that I have no ability to learn from my more experienced colleagues because I'm working from home. And they really felt that that was directly impacting their ability to progress in work. Lots of young people talked about life plans being on hold, can't leave home anymore. And then all of these issues were doubly impacted for people from vulnerable backgrounds, such as people from refugee backgrounds. There were massive gender implications of lockdown. So every single group that we spoke to of women of every different background talked about the fact that they had done the majority of the homeschooling and the emotional labour around children feeling anxious. So this isn't to say that there were no men who talked about the fact that they had done this work, but in all of our groups, women had said that they'd done the bulk. And this meant that single mums talked about the fact that they were offered more work but couldn't take it. Freelance artists talked about the fact that they had to move on to universal credit because they couldn't try and get contracts because they were supporting their children. Professional women talked about the fact that they were getting up at 5 in the morning to get their work done by 9 o'clock, to then homeschool the children all day, to then work from 6 till 10 at night. Mums of SEND children talked about the fact that they had to give up work entirely because there was no way they could support children with additional needs and work at the same time. And what was really interesting is lots of people talked about the fact that employers had women in more permanent kinds of work. Employers had conversations with them about how can we make sure you can work flexibly in order to be able to work and homeschool. But not many employers had conversations with their male employees who had children about doing the same thing. So it seemed the emphasis was on women doing the homeschooling. And I just wanted to come back to this issue of families with children with special educational needs, because in terms of the economic impact, lots of people said it totally wiped them out. The schools closing, because the implications of having a child with special educational needs or disability are very different in terms of being able to sustain their care, their additional support, to having a child who doesn't have those additional needs at home, who you might be able to give a bit of support, then they have laptop time, just totally different. So lots of parents of children with special educational needs talked about the fact that their economic situation was really damaged and they felt a bit let down. There was also some specific situations for disabled people around just lack of information. So disabled people talked about the fact that they received direct payments for their care workers, support workers, suddenly not able to have them in their house. This payment is building up. No one has given them advice on it. Really nervous about the fact that the year after it will be clawed back. Disabled people also talked about having PIP assessments on the phone by occupational therapists and how it was almost impossible for them to get a good hearing almost. And people talked about the fact that people who receive ESA got no uplift, and in situations where they were able to receive this extra bit of money for a supported work payment, this suddenly disappeared because the job opportunity was no longer available. So I'm nearly at the end now, but every group talked about the massive impact of mental health and social isolation. And what became the key message that came out of this was that every single group talked about how volunteering was a lifeline. So whether that was volunteering with the Samaritans or in a carers group or with older people, the fact that all those volunteering opportunities disappeared meant that all of a sudden that social interaction, the structure of the day also disappeared. And so a key message was how important volunteering is for our communities in Calderdale. And then finally, in the conversations that we had with the voluntary community sector, what became apparent was there was a massive demand for their support, as we know, and they adapted really quickly to all of the different needs and support services they needed to give. So on top of having to manage things like buildings, risk assessments, all of that, they also lost a lot of their income generation activities. So that could be renting out rooms or services. So a lot of that income went. And then the big challenge was there was all this funding suddenly flying at organisations around COVID and supporting communities around COVID, but it was all very short term. And alongside this COVID support is also the main services that they deliver, but actually the ability for them to continue those services or strategically plan around their main bit of work was very difficult because they were trying to manage COVID and longer term funding didn't seem to be coming out or considerations around it. So there was just a general feeling of precariousness amongst the voluntary community sector. And so within the report that you've seen, there's lots of recommendations. And I suppose what we're just hoping is, even though, you know, that was last year and we're obviously in a brand new scenario at the moment, but we're hoping that some of those recommendations will really inform the development of the recovery going forward. Thank you.
Thanks very much, Roisin. That's a good presentation of what's a very powerful report, some very powerful case studies in there. So I'll open it up for any questions or comments. Megan, you've indicated in chat.
Yeah, I've even remembered to unmute myself. Very quickly, I've seen quite a lot of that before, Rasheen, when you've been doing it at different places. But have we something set up so that, you know, you're hoping people are going to pick up on it? But is there any way of keeping track that it just doesn't get lost? Because, you know, I'm not always the biggest fan of scrutiny, but when scrutiny get down to it and do a report like this or something else, it would be a real shame if it got lost somewhere.
Megan, so I know that Sean Rogers, who's obviously doing a lot of the work on the recovery plan, you know, is really considering a lot of this stuff, and I know that she's integrating that into the recovery plan, and some of the stuff that obviously needs to be done immediately, I think, has been fed up to the relevant people, and then the longer term stuff I know is being fed into recovery plan. But Mike, I don't know if you wanted to say more about that.
Thank you, if that's okay, Chair. Yes, absolutely. And Councillor Kavanagh has been to the council and partners anti-poverty strategy group, and I think that's a good place to go back and revisit this in a few months' time. We had some plans. We have some plans to take the report out to other organisations, which we actually held off during the pre-election period. But for example, we do hope to go and talk to the DWP directly about the report. And we have, I don't know whether we actually formally asked Councillor Swift this yet or not, but there was a proposal that we should come to the Calderdale leaders meeting at some stage with this to get a broader information about this. So yes, certainly two things. One is to broaden out the audience for this report, and the other is to use the anti-poverty strategy that's shared by a group that's chaired by Sarah Richardson in the council as a place to revisit this perhaps in a few months' time to see what the response has been to the report.
Thanks, Mike. I think it's certainly important we kind of come back formally to the report, but yes, I'd concur that it's being picked up through the recovery plan. Very happy to see it come to the Calderdale leaders group as well. I've got a few people wanting to comment now. So Deepika first, and then Julie.
Thank you, Chair. First of all, I just wanted to commend the team of councillors who spearheaded this. I think it's a really good broad view in terms of what's happening out there. And I think the word precarious, I think we're all feeling that at the moment, despite where we are and the fact that we're working collaboratively and the measures we're taking. I think, you know, everybody's feeling that, you know, things are always on the tipping point at the moment. I think my plea is that we continue to make sure that the work that's happening as a result of this report and this insight is continually brought back here in a periodic basis, so we know what's happening. I think my other plea is that there's a lot of really good work going on out there around the economic recovery, around the integration agenda. There are a number of other wider opportunities linked to whatever the outcome might be from the Community Renewal Fund, and so on and so forth. So my plea is to make sure that we connect the dots up here. There's a lot of work to do and a lot of people who need a very cohesive approach to how we support economic recovery as well as social recovery as well. So just wanted to say well done. I think it's a really comprehensive report, and as a voluntary community sector, we absolutely need to be and are part of this work. Thank you.
Thank you, Deepika. Julie Jenkins, and then Councillor Evans.
Thanks very much, Councillor Swift. Yeah, just to say what a powerful presentation. And it just took me right back to the beginning of lockdown, and you forget, don't you, everything that, you know, families, particularly families in poverty, struggled with over that period. And you kind of forget, don't you, about the kind of key worker focus, and only certain children were allowed into school, and that digital divide that started to emerge right away. And also, you know, the fact that children with disabilities are sometimes so vulnerable to infection. The need to keep them safe and the respite closing, didn't help the situation at all. Yeah, I completely understand that. And I think there's some really powerful things that Councillor Kavanagh and the group have really pulled out from people in Calderdale. I think the other thing that we forget is some of the really good things that we did to start to respond. So the Never Hungry Again campaign, the work we did with the Community Foundation around the digital divide and providing laptops, trying to get access to the internet for families. All of that work, was absolutely fabulous local response, to the national and global situation that we were working with. But I just wanted to touch as well and just mention around the recovery, the education recovery in particular, because we know this is a huge divide. There was a divide there anyway between the children that do well and those that don't, and we know that's grown. Your example, Councillor Kavanagh, there of a family with one mobile phone. How on earth can you do the work that's been set, as bubbles have been closing, etc., if you haven't got the kit that you need? So we know that's been a real issue, and we know there's been an awful lot of lost education. So there is a lot happening around education recovery. There are going to be summer schools. There's going to be a lot to do to prepare children for the transition from primary up to secondary in September. There is money for tutoring and money coming down to schools. I think it's a contentious point whether there's enough money, and you'll have seen that the Tsar that was appointed by the government has actually said, in terms of the money that's been made available, doesn't think it is enough. But we're doing a lot locally around education recovery, working with the primaries, the secondaries and the college, but also with the early years sector, because we know those are the young people, that have lost a lot of nursery time, a lot of socialisation, language development, etc. So it's just to reassure the Health and Wellbeing Board of kind of what we're doing around on the ground. And finally, just to mention around the 16 pluses, there's a lot of work happening, looking at the lack of work experience, lack of apprenticeships, really working with that cohort. It's going to be a really tough workplace to try and get into. We know when children leave school this summer, and the worry, we've heard from the Youth Parliament as well, of the worry for young people who haven't been able to take their exams, and what does it mean for their future. So I think you've captured really well, Councillor Kavanagh, the work of the voice of our young people and the voice of families, really powerful. But I just wanted to assure the Health and Wellbeing Board as well what was going on locally, and then very focused on education around recovery too. Thanks very much.
Thank you, Julie. Ashley, Councillor Evans.
Thank you, Chair. Yes, I can only repeat whatever people have said so far. What a great report, what good work across party and all of those sorts of things. And one of the things it stressed to me was raised the awareness of the interaction of issues, the way that it's fine saying people have this, people have that problem, people have that problem, but it's the combination very often which causes the real problems. And I think that was very well stressed and emphasised in that particular report. I think that what we've done is we've learned a lot about the issues which rise in a major situation like the pandemic, and to a certain extent, and please don't take this the wrong way, that's historical, and we will have learned, if God forbid we have anything else like this just comes up or this extends. But what I also wanted to ask was, and it seems to me that there is a possibility that we have learned many things which will apply in the future anyway, that we can apply to the way, yes, we're talking about recovery, which of course is essential. And once we have recovered, well, you don't actually recover, do you? It's an ongoing thing. So I think that we should take on board a lot of these issues which have been raised in this particular report, because they will be appropriate for the longer term within Calderdale, and the things we've learned from that will be very, very important. So I think that was one point I wanted to make in particular. A sort of linked point, if you like, is that understandably there were lots of issues in relation to mental health coming out of the pandemic situation. One concern in that sort of area, and I totally agree with the need to do work on that. Correct me if I'm wrong, I believe that Healthy Minds is being withdrawn in the Upper Valley, in the Hebden Bridge, Todmorden area. If that is the case, then that is very worrying generally, and particularly in relation to what we're discussing this morning. So I just, I would want to make that point strongly, that if that's the case, then we need to look at that very seriously in the Upper Valley. Thank you, Chair.
Thanks, Ashley. I'm aware there's some ongoing discussions, so I'm not sure what the current position is. Rasheen, do you want to come back on any of those points?
Yeah, just to say thanks for all the supporting comments. Ashley, just into what you were saying in terms of it's historic. What is interesting is that a lot of what was happening to people was based on existing inequalities. So all COVID did was exacerbated inequalities that already existed. So, and particularly emphasize the fact that we've got a massive amount of people, you know, in the low wage economy and in work poor that were just about managing, and then COVID meant they no longer could. So it is historic, and it does relate to a very specific situation, but it's just highlighted the changes that we need in our communities in order to enable people to thrive. And yeah, Julie, it's great to hear. And the reason, just to say, the reason the report wasn't looking at the, you know, there were brilliant things, they're never hungry again, and all of that stuff that was done was really excellent work. The report was just pulling out, you know, looking at the challenges, but obviously we really recognise all of the important stuff that went on. Yeah, that's it, I think, Chair.
Thanks very much, Rasheen. So thank you again for coming along, presenting, and well done on the work. Oh, right, okay, I was just about to wrap up and I've now got two more hands, so that's fine because we're well ahead of time. So I'll go to Stephen and then bring in Ian. So Stephen, Stephen,
thank you very much, Chair. Stephen Baines, that was another former member, wasn't it? Combination of Ian and I, in one way or another. So yeah, just to echo, it's a wonderful report. I think I've counted 23 recommendations, and I'm sure they're all extremely important. But with all these situations, it's always wonderful to have, you know, the top priority 2 or 3 areas from the insights and the evidence that's been gleaned. What would you suggest are, you know, the top few things that we absolutely, as an imperative, must be focusing on? It'd be wonderful to hear your insights on that. From my particular perspective, I think one of the recommendations which states that the council should prioritise services and activities that promote good mental health in Calderdale's recovery plan, including a plan to resource mental health initiatives longer term, seems to be sort of an overarching thing that would impact on so much of the population. And thinking, of course, because we've got services for young people, we've got IACT, we've got community mental health teams, we've got voluntary sector supporting so many different initiatives around mental health. But when you say activities, we know that the best activity for your mental health is physical activity, exercise. And we have obviously Active Calderdale as a wonderful program. So it would be fantastic to see how this summer, so in the coming weeks and months, we can create a real movement around physical activity and really encourage many people of different generations to be out in a safe way, exercising and using the good weather of the summer to as a sort of a stepping stone into better mental health, rather than the sort of isolation that seems to be maintained. People seem to have lost their confidence of going out, of all age groups. We hear stories in general practice of teenagers staying in the rooms, not going out, fearful, lost their self-confidence, don't want to go to school, don't want to go to clubs, don't want to go to dance classes, all kinds of things that they were doing in the past. And likewise, elderly patients who feel that they are, despite the fact that they've now been vaccinated, still vulnerable if they go out. So I think this idea of physical activity, safe physical activity, and the council and your partners really promoting that is something that for me is an absolute imperative in the coming weeks.
Thank you, Stephen. Ian Baines.
I want to kind of pick up on a point that Councillor Kavanagh made and kind of amplify it. And I think Councillor Evans was right to talk about it. This is some historical inequalities. What COVID did is amplify those. And I think often some of the phrases we hear now is about building back better. But if we build back better, but it failed to fundamentally resolve some of the structural inequalities that have occurred, it will still potentially have some of those gaps, and actually some potential those inequality gaps may grow. So something that I think I'm trying to think about in terms of we talk about social care is building back fairer, and to address some of those things. And I know Cabinet made a really brave investment decision in this year's budget process to ensure that people who work in adult social care are paid more than the national living wage. As a director of social services, I still think we have to get braver and have a bigger ambition about recognising the value of social care. And what we saw through the pandemic is one of the challenges that people often had to work more than 2 jobs in order to manage in-work poverty. And I think what we need to think about is how we, both locally, regionally and nationally, start to think about actually how do you get a sustainable real living wage in order that we can eradicate in-work poverty. So I just want to kind of emphasise that point that Councillor Kavanagh was making, and kind of endorse that point, really.
Thanks very much, Ian. I've got Debs and then Megan.
Hi, yeah, it was just to conscious that we've got an item later on the agenda of this meeting around with a proposal around refocusing our health and wellbeing strategy, our wellbeing strategy, and it just feels really important that we draw the connection between the work we've heard about here and the potentially reprioritising the things that we're going to work on together as a board. So I know that's a really obvious point, but I just didn't want us to sort of finish this conversation without making the connection with the item that's later on the agenda.
Thank you, Debs. Agreed. Megan.
Yeah, I just wanted to make a comment about children with disabilities who are actually at the special schools. I know one young man quite well, and he seems to have spent all the last few months, because, you know, a lot of these young people have not got the immune system that some others have, and he's been to school for a week, maybe 10 days, then he's off and has to isolate, and then he goes to school again for a few days, then he has to isolate. Well, you know, accept that he has to isolate and everybody else, but it interrupts any sort of, I can't think of the word, home life for these young people. And particularly if they've got brothers and sisters who mum's trying to give a bit of extra time to. And yeah, that bit of extra time doesn't just seem to be there anywhere. And that's not a criticism, it just seems to be a fact of the position we're in.
Thanks. Yeah, I think probably a wide point that the pattern of disruptions for children since they went back and through isolation will be different between schools and classes as well, but perhaps particularly affecting special needs. That's perhaps something we can pick up and look at. Okay, I'm not seeing anybody else indicating. I mean, it does seem to me there are, you know, it is really important we make sure that these things are followed through. In one sense, we don't want another separate action plan to deal with this. We do want to build them into things like the recovery plan, and Debs has made the links to the wellbeing strategy, which I was going to mention as well. I'm sure if you've not already seen it, we'd be really keen for this report to be shared within your organisations as well. And I could probably take the liberty of suggesting that Rashid would be happy to come and talk about it, or other colleagues from the panel as well. But I think it will be useful to make sure there is a catch up through the anti-poverty partnership, as Mike suggested, but perhaps we may want to just catch up a discussion on how this has fed into things later on in the year. I think it emphasises, we talked a bit about the legacy in terms of long COVID, but actually there's a whole host of legacies which are going to have long-term impacts on the well-being of people, which we're going to have to work out how to prioritise and address over the year ahead. So people happy to receive that report and happy with that kind of summary of actions for going ahead. Okay, I've seen lots of nods. Thank you. And thank you again, Roisin, for coming along and presenting this morning.
Thanks everyone for all the comments, and bye-bye.
Thank you. Okay, so take us on then to item 8, Calderdale Care's next steps. What you've got here is a report that's been to both the CCG governing body and report that went to Cabinet on Monday. I suppose just before I hand over to others to speak in detail on it, I just want to remind people, that we started talking about Calderdale Cares and our approach to making it easier for services to work together at the grassroots, finding out what worked and building structures around that rather than a top-down reorganisation as the way of integrating probably 3 or 4 years ago. And although this fits in, much of what we're doing now fits quite closely with some of the newer government guidance and the white paper and potential legislation, to emphasise that what we're clear about, both in Calderdale and West Yorkshire, is that we want a joined up system that works upwards from the localities and that's driven by our priorities, not by the legislation and not by national guidance. And I think there's a shared intention to deliver that. So I'm not sure who wants to introduce parts of this report first. I know we've got Debbie here who wrote a lot of it. Robin, I don't know if you want to make some introductory comments.
Yeah, that's right. Thanks, Chair, and thank you. You touched on some of the points I wanted to make, which is helpful, which is just a real emphasis on the Calderdale Cares is a set of values and a set of ways in which we do things around here, and I think Debs has exemplified that brilliantly by the description earlier in the meeting about how Kenneth is experiencing how we work. And I think that's probably going to cover better than I could say what I was going to say, which is it's not about your kind of badge, it's about your purpose, and it's about your attachment to place, and it's about what we're trying to achieve and the outcomes. And there'll be times when we clearly operate with a very structured, focused organizational brief in what we do, quite rightly, and there are certain ways in which there are differences across our agencies, but I think that the pandemic has really almost compelled us to operate in the vision of Calderdale Cares, and it's a set of values, just like the vision for Our Place 2024 is a set of values as well. And I think Debbie's going to just kind of describe that, but I think very important that Ian Holmes is a part of this conversation, because it is the way we'll do things around here within place, but it also connects in I think a wholly productive, collaborative and constructive way with how the ICS is forming. And I think we're at a stage of forming and how we will form as an integrated care partnership in place. So it's building on that, but recognizing that there will be some change and some differences. I think the other thing I want to say is that it's sort of, we're in a state of becoming here. So we're not presenting you with a final product. What we're intending to do later in the year, probably around September time, is have probably a slightly more structure focused discussion, both with our partners, CCG Council, CHFT providers, etc., but also share that maybe the Health and Wellbeing Board, but that will follow the way we do things. It's not, the structure doesn't dictate, the structure will follow our sense of purpose. And it's great, and just maybe, I don't know, we welcome Rachel Bevans on the call, who has joined, and as an example, welcome to Rachel, who's just joined us this week. I'm really pleased that Rachel's going to be supporting us from a programme perspective. And when I say supporting us, and I think it just reflects the fact that I think working across Ian and Debbie, Ian Baines and Debbie, so just reflecting the sort of sense of collaboration in every way in how we do things. So that's really what I wanted to say at this point, leader. And just to say also that in this, it's not just how we deliver, but it's how we care for our workforce. And there's a bit of work developing, which I'll share at the We Are Calderdale event next week, which is about how Calderdale cares for us. And we're really, I mean, you all will be aware of the, I'm sure, the select committee report, or at least the coverage of that in terms of the impact on well-being of our health and care workforce is significant at the moment. And so we're developing this as a kind of way to care for our workforce and enhance the resilience and look after the people that actually deliver, so they can look after us. And just to say, that's very much part of this approach, but I'll hand over to Debbie if that's all right. I think she's got a couple of slides.
Thank you. Debbie?
Right, okay, so I'm just going to be talking through the through the cover paper, really, that has the key highlights on. Thanks, Robin and Tim. You've kind of covered you know, a lot of the kind of real nuance of this, and welcome Ian being in the room as well from our ICS, which is fantastic. Just to mention a bit of Rachel, I know that she's been introduced. If people want to be part of Rachel's induction, just pop a note in the chat, and we're doing an induction for Rachel. So really happy to include anybody that has something to say, and I know many people may well, which is great. I'm just going to mention a few things really that are in the report. So just picking up particularly the starting point for the report, the overview. I think this has been mentioned. What comes first is Calderdale Cares, and that's our vehicle. It simply amplifies the direction of travel that we've been on with Calderdale Cares, and that's how we're seeing it. We believe also that the direction of travel supported that's talked about in Calderdale is in line with expectations around from the new planning guidance, and also it aligns really well with the 5-year plan that was developed by our ICS and the 10 top priorities. So the ask today is that the Health and Wellbeing Board notes the direction of travel and also thinks about the role of the Health and Wellbeing Board in the strengthened arrangements. The background in the cover paper just talks about Calderdale Cares. It's already been mentioned. It's been around since 2018, so quite a long time. And it's built around all the principles that we all talk about that were important to Calderdale. It mentions the fact that there's 2 big jobs to do really from an ICS point of view. So the ICS will construct itself as a statutory body and will also support the development of ICP, so integrated care partnerships in place. The things that will help us do is come together even more at place than we have already. It'll take away or will give us a real shift away from those traditional commissioner and provider splits that we've had, to an approach where we're all working together and against a set of accountabilities that West Yorkshire will negotiate with us. I think the words from West York, when we talk at West Yorkshire, are about permissiveness and flexibility, and that much of this is for local determination, although we do know that there may be some things that will be prescribed. 3.6 just mentions the fact that the CCG will cease to exist from the 31st of March 2022. And what we know is that the contracts for staff will move to the ICS NHS body at some point before then. And I guess it's just to assure the board that we are spending a lot of time with our staff in managing and supporting them through this period, as is the ICS, because this change doesn't just affect CCG staff. What's written about the Health and Wellbeing Board is really that it maintains a really important role in the partnership. It particularly, the white paper talks about the important role it has in joint strategic needs assessment and the wellbeing strategy that we'll talk about later on, and that it's a really important place where the broader partnership comes together. So there's a clear role a clear role for the board going forward. We have a set of jobs to do, and we're really glad that Rachel's here to help us with those. There's something about our vision and strategy, which we've talked about, and we're really strong on in Calderdale, and therefore what does our underpinning governance look like? We have to construct the ICP, the partnership board. We've got to think about developing a clinical and professional forum where not just doctors, but our nursing workforce, our therapists, our social workers come together and develop clinical strategies to support the overall delivery of our wellbeing strategy. Thinking about ways in which we can create more oversight and assurance at place. So we do some things separately that we might be better doing it more effectively together. Things like, I don't know if we're looking at oversight of discharge. That's probably done in a number of places, and bringing that together and having really informed conversations will help. We believe there's also a role for our Calderdale Community Collaborative. That's currently the place where our providers come together and look at transformation of community services. And we believe that's got a really important role going forward. There's a lot we don't know at the moment in terms of accountability and how that accountability between the ICS at West Yorkshire and the ICP at Place will work, but we're working on that together. There are 9 work streams that have been set up, and we've got a really good representation into those and lots of information flowing from each of those. There's no real clarity yet about financial implications. What we do know is that will be wrapped up in an approach to accountability that is kind of yet to be clear. But I think, I suppose one of the things is this is not being done to us. We are doing this together. So we're working, and there's a petal diagram, which we will, as we talked about doing a more in-depth session, and the petal diagram really is that, you know, West Yorkshire at the centre and the petals of each of the ICPs kind of linked to that flower, and that's how the intention that it will be. We will all work together as part of a whole, but yet in Calderdale we'll be very accountable for delivering Calderdale cares and moving forward on some of the prescribed items that are yet to come down from the centre. So I guess the takeaway message is this is all still about Calderdale cares, and we're working really closely with our ICS because it is by default us. So I'll stop there and hand back to the chair.
Thank you, Debbie. I'll bring Ian Holmes in next. Ian, I know you've been with us before. I'll let you explain what your role is rather than me do it on your behalf, and perhaps we'll talk about how this relates to the West Yorkshire.
Yeah, thanks, Councillor Swift, and hi everyone. I have been here before, but my name's Ian Holmes. I'm director for the ICS, and I think between you, Councillor Swift and Robin and Debbie, you've covered it really well. We as a partnership have been in existence for 5 years now coming up, and we've worked really hard in that time to make this feel like an equal partnership between places, between providers, local authorities, communities, Health Watch. And we've built an ethos where, you know, I feel like most leaders in the system, if not all leaders in the system, feel like they're part of the ICS and feel like they've got a leadership role in the ICS. And we are desperate to maintain that despite the changes in accountability. So one reading of the white paper could be that you've got NHS England tells ICSs what to do, which then tells places and organisations what to do. And that's absolutely not the way that we've worked in the last 5 years, and that's not the way that we want this to work in the future. So we are doing this work around what we think that the specific ways of working and structures that we'll have in the future will look like. We've got a really good starting point for that. You'll remember we came and talked about the MOU, the Memorandum of Understanding that we developed in 2018, which describes how a partnership will work. And actually, I think that takes us a big proportion of the way there in terms of the future arrangements, even though the statutory accountabilities will change. We are doing this work inclusively. So, Councillor Swift, Robin, Debbie, Karen, Steve, all really closely involved in the West Yorkshire and Harrogate work, Neil. And we're trying to, as ever, we're trying to co-produce this with partners from across the system. One important piece of work that we've got is a governance working group that Tim Riley, who's the accountable officer and leads CCG, is leading. And what that will do, it'll describe that kind of relationship between the ICPs, the place-based partnerships in the ICS. And as Debbie said, there's still work to be done around that. But in describing those arrangements, as I said, we absolutely don't want that to feel like positional or kind of hierarchical performance management. We want that to feel like a model based on mutual accountability and distributed leadership. So as that work evolves, and I think we'll be hoping to get closer to what those documents will look like in September time. Really happy to come back and talk to those. But just to say, kind of the partnership ethos and arrangements that we've built over the last 5 years are what will see us through. I think in the future arrangements, we're really keen to build on that and support our arrangements to evolve rather than starting from scratch. So I'll pause there, Councillor Swift, but really happy to take any questions from a West Yorkshire perspective.
Thanks very much, Ian. So I've not got anybody. So looking for anybody who wants to comment or any questions at the moment on this. Stephen, yeah, Dr. Cleasley.
Thank you, Councillor Swift. Yeah, so yeah, we had the sort of an early meeting yesterday of the Clinical and Professional Forum in Calderdale. An initial group of about 12 or 13 clinicians and professionals coming together just to speak about and think about the clinical forum as it exists at the ICS and whether something similar in Calderdale would be useful. And there was overwhelming consensus that it was the right thing to do. One of the challenges there was, is this going to be just another meeting, and what additionality will it bring? And I guess the same is for many of these different new structures that are being described in this paper. What can we drop doing? Because we can't do these as well as all the other things. Otherwise, we're all going to go in an early grade of mind, health and well-being. So it's just to try and get that sense of perspective and priority and rationalization of all the different meetings as we work increasingly in partnership. What can we drop?
Thanks, Stephen. That's a really important point, and the danger of meetings just multiply. I mean, this should be an opportunity to streamline the governance and improve it, but that's always easier said than done. And the temptation is simply to make extra groups because of that. And of course, I've said a few times now, the real test of a genuine partnership is whether you're happy for a decision to be made when you're not physically, when you're not actually in the room, and that's tough, and that takes time to really have confidence, not just in each other's intentions, but that we have a shared understanding of what it is we're trying to do. It's hard going, and these discussions, locally and regionally, do end up spending quite a lot of time talking about governance at the moment, which is unfortunate because we're not doing this really to devise a better governance structure. We're doing this to improve the way we deliver healthcare and well-being to people. On the other hand, I also know if you don't get the governance right when things are working well, you can't fix it if things ever go wrong. So you've got to get the balance right on the time on these things. Robin, I think you wanted to come back.
Yeah, just to briefly say that I think the opportunity is for us to stop doing a lot of the things that we were required to do around the commissioning conversations, whether it's ICE or clearly some of the governance around how commissioning is operated, and make that more about place and more about the connectivity. So between all parts of the system. Really, it's a chance to realise the Calderdale Cares principles, and that we'll be removing some of the governance that we've needed to do. And we've just got to make sure that we do that in a way that's effective, productive, and doesn't just replicate. So it's not sort of CCG Mark II, it's a genuine integrated care partnership, is a new way of operating. And it will mean some things will stop. So I'm hopeful we've got to aspire to do that, because Stephen's right, there isn't both the capacity and there isn't the purpose and the rationale to do it.
Yeah, thank you. I think that element of the change at national level is getting a bit played down, isn't it? Because it doesn't suit the government to do it. But but it's why I find some of the criticisms of the changes around the ICS so difficult, because they're coming from people who in 2012 would have been campaigning against the competition clauses of the 2012 Act, and now sometimes seem to be telling me we should be keeping them, which I find completely bizarre. This really is about, for me, it's about building a system that works on collaboration and cooperation rather than on competitive tendering and a market model. But of course, there are legitimate questions to ask about making sure that we have the right principles in place in terms of transparency and so on. And I know those are keenly felt at West Yorkshire level as well. Ian, do you want to come back?
Yeah, it was just on that point, really, and I agree. I think there is an opportunity to streamline, and one of the things that was quite prominent in the white paper was this ability to form joint committees. So you can have committees where you've got cross-sector parties making decisions together, and actually that was quite difficult, particularly for the commissioners in the 2012 Act. And if we are able to construct at place level and at system level those kind of cross-sector, NHS local government groups that can make binding decisions together, that should theoretically allow us to streamline quite a lot of what we do, I think.
Thanks very much, Ian. And I guess finally, just to reiterate, that we do see the health and wellbeing boards as being a crucial part of the place-led element of this in a West Yorkshire model. That won't necessarily be the same with other ICSs, because some ICSs only cover a single health and wellbeing board, and that's one of the complexities of this system, but of the change at regional and national level. So I hope that gives a feel for where we are. I think this is probably something that, further on in the year, we'll probably want to have a bit of a workshopy type session about, to make sure people really get what the changes mean for them. It is also challenging for everybody in the system, but obviously particularly for people in the CCGs, because it does create uncertainty about where their posts will be going. Although there's that commitment to rolling the roles forward, it still creates that uncertainty, at a time when there are a lot of other pressures as well. But that's something I know people are very well aware of. So can I just thank everybody for that item and note it, and I'll move us on to, well ahead this morning, I'll move us on to item 9, the wellbeing strategy, and hand over to Debs for this item.
Thanks, Councillor Swift. I mean, this meeting. I was just congratulating Mike for the ordering and the building, I guess, of the agenda today, because it feels like the conversations that we've had earlier in the meeting, sort of, I guess, lead us to think about what our priorities are, and lead us to think about our wellbeing strategy. I mean, we're now halfway through the life of Calderdale's existing wellbeing strategy. So it was 2018 to 2000, sorry, apologies. Sorry. So we're now, so it was 2018 to 2024, so we're sort of halfway through the strategy. I mean, when the strategy was published in 2019, we had no idea, did we? It was before my time, but you will have all had no idea what was about to happen. And you know, the impact of COVID-19 on population well-being and on the social, economic and environmental determinants of health has been massive. And we've heard a lot from Councillor Kavanagh, haven't we, about that today. We know, as we've heard from Councillor Kavanagh and the conversations today, that the pandemic's exposed and exploited existing inequalities, and the impact of that will last for decades. And we've heard, haven't we, in the conversation about how children have missed opportunities for essential social and economic development, and we know that the greatest impact of that's been on the youngest and poorest children. And we've also heard from Councillor Kavanagh about the trauma of unemployment and bereavement and loneliness and relationship issues, loss of community cohesion. And we know that that will impact on mental and physical health for years to come in Calderdale, and along, I guess, with those determinants of health, alongside long COVID, alcohol consumption, through self-medicating. We know that all of that is going to place extra demands on public services for a generation, not just health care and wellbeing services, but all public services. And we know as well, the Marmot review, and Ian mentioned earlier about building back fairer, and the Marmot review 10 years on really focused on the things that we can do and the need for us to build back fairer as we recover from COVID. So the challenge is enormous and different to what it was in 2018, 2019 when the strategy was written. But at the same time, we've also heard about through the conversations we've had, both the first item on the outbreak plan and also the Calderdale Cares and the ICP item. We've also heard that at the same time as all of this, that partnership work to improve health and wellbeing outcomes has transformed in Calderdale since we wrote the strategy. Communities supported by our voluntary and community sector have stepped up in so many ways right across the borough, showing the kindness that we're famous for in Calderdale, and the response to the pandemic has led to a real step change in some of the things that we know enable us more integrated working, like sharing data, joining up services, and the example I gave about Ken earlier, not knowing, not understanding that, realising that the team of people from across a lot of organisations rather than from a single organisation. So we've got a massive challenge that's different to when we wrote the strategy, but we've got enormous opportunities, haven't we, and changes, if you like, in the way that we can work together. And I think all of this really shows what Calderdale's capable of. When we focus our efforts on a small number of goals, we're capable of enormous things, and I think we've shown that, haven't we, in the conversations that we've had today. So what we're proposing is that the board considers refocusing our wellbeing strategy to reflect the challenges that the pandemic have brought and the transformational opportunities that our amazing response to the pandemic has shown us that we're capable of. So the existing strategy sets out 4 ways that we're going to work together. So developing a new relationship with communities, shifting the focus on prevention and outcomes, joining up and integrating services and integrating health into all of our policies. And I think we've heard, haven't we, today, I mean, some of the way that the relationship with communities, that we can move beyond consulting to co-producing wellbeing with communities. We've obviously, really keen to focus on outcomes through the work that we're doing with Calderdale Cares, and joining up, the opportunities to join up and integrate services are phenomenal now, aren't they, compared to when the strategy was initially written. I guess for me, in light of the pandemic and what we've heard about today, my suggestion or my wonder if we should swap integrating health into all of our policies for a relentless focus on addressing inequalities, to provide even more of a focus to addressing the challenge. And then the strategy also sets out 27 priorities across the life course. And I guess, as I say, when we focus on a small number of things, we know what we're capable of, what we can do. And I guess the question is 27 priorities too many? Would it be useful for us to focus on a smaller number of priorities that we can really coalesce around as a partnership to really, really make a difference on? So I guess the questions that I've got for you now are, I guess I'm interested in your reflections on whether we need to refocus the strategy on a smaller number of priorities, and also whether you're happy for us as a group to do some work over the summer on refocusing the wellbeing strategy with a view to have a sort of a refocused strategy ready to come back to the board in the autumn. So Councillor Swift, it's just those 2 questions really, in light of where we are now, how the context changed. Really interested in a discussion about the next steps really with that, and whether the board agree that a more focused approach would be useful.
Thanks very much, Debs. So I'll invite if others have comments rather than launching myself, if that's okay. Anna, yes.
I'd really support that approach around refreshing and re-looking at the focus of the Health and Wellbeing Board, because, as you say, over the last year, there's been such tremendous progress on some areas, but I think also greater clarity about where the board can have the most impact and the most pressing needs coming out of the pandemic, and because of the sharp relief on inequalities. So I think it could really reinvigorate the work. And really as part of the previous paper around some of the changes around the ICS structures, the place-based integrated care partnership, give a really clear direction around what we want to deliver on in the year ahead. So I'd really welcome that. I think it'd be really energising to do that.
Thanks, Anna. Neil?
Thanks, Chair. Just to sort of echo Anna's point, I think it would be really good to have some focused one. I think we can sometimes have a very long list and not achieve a lot, whereas actually if we're focused, I think we'll get a greater impact. And I think as long as they're aligned to the West Yorkshire and Harrogate partnership and really help us focus, I think that will really help us as a system prioritise from health and social care. So I would welcome and be happy to be involved in helping with that.
Thanks, Neil. Debbie?
I guess it's from that point Neil just raised about the alignment with West Yorkshire. So I don't know if you remember, but as part of the 5-year plan, the ICS had 10 big things it wanted to do. It's just in the process of refreshing those at the moment, and I'll make sure that Debs is really connected to this. If not, I saw a presentation last week. They're unpacking each of the 10 in terms of what good would look like, and then starting to look at the data and where each of the places is on kind of the journey. And I think there's an opportunity, they were keen to create the opportunity back into localities, and how much of this is measurable at locality through proxy indicators or the same indicator. So I think I'll share that with Debs, and I think there's a real opportunity to join that up.
Thanks, Debbie. Ian?
I think I just want to kind of echo what Debs has been saying in terms of that it does feel that it's the right time to kind of refresh and reflect and focus down on what's important. I suppose at the heart of what Debs is also saying is that what we've learned through the pandemic is that if we engage communities in the conversation and the solution, we will get better outcomes. And I suppose part of the exercise over the summer is to hear those community voices and help them shape the outcomes and the kind of priorities they'd like to see. I think too easily we can do this from a system or organisational perspective, but actually listening to our community voices and actually what they would like to see as good outcomes and what good look like for them, rather than doing it from a professional, organisational or system perspective, will help us understand and coalesce around a stronger commitment as well, I think. So I'd just like to echo doing the piece of work.
Thank you. And with a number of comments in the chat, I think all saying similar things. I mean, it seems to me to make sense that obviously we need to rethink what the big priorities are post-COVID, both in terms of lessons, but also in terms of some of the pressures having changed as well. I suppose my one morning note is I've been in quite a few discussions at the moment where we've been talking about the need to have less priorities, which I entirely agree with. But that also then leads to a string of people saying, why haven't you mentioned X? So we do have to be tough about it, but also to have a narrative that explains that many of those other things do get addressed. And actually, if you pick the right priorities, that the changes you make for those often benefit the way you do everything, or should do, if we're really thinking as a system and not seeing things in isolation. So I'm always struck when you have broad discussions about dementia-friendly towns and child-friendly towns, actually, how many common themes there are across the two, as an example. Is there anything else? Does that give you enough of a steer, Debs? And I do think Ian's suggestion, and we might want to talk to colleagues from Health Watch about this, about ways we make sure we listen to voices as well. We can't ignore that people's experiences of services is really stretched as well, and if that's not reflected in what we're saying, people won't engage with us. Yeah. So is there anything else anybody wants to add on that one? Okay, thank you. You're all
Councillor Swift, can I
restrained. Sorry, of course.
Sorry, Councillor Swift, sorry. Can I just make one comment? I'm really sorry. Have I frozen? Am I here? Can you hear me?
Yes, we can hear you.
Oh, sorry.
Yeah.
Sorry, Councillor. I thought I'd frozen. It was just a couple of points that's been really helpful, and the really helpful suggestion about the engagement over the summer as well. It was just to come back, if I may, on the links with the ICP. And the priorities in the integrated care partnership, which I agree is going to be really important. This, though, is our opportunity to set out what needs to happen in Calderdale, I think. And actually, what I would say is this is our opportunity to say what needs to happen in Calderdale, and also to set out what we want to ask of the system level. So I think it's just really important that this isn't just about us fitting our strategy with what's with the system strategy. It's actually about us influencing the system strategy as well. So it was just to make that point, Councillor Swift.
Yeah, completely agreed. Yes, useful list of priorities from Stephen in the chat there as well. Yeah. Okay, so we're accepting that we'll move forward in the way suggested. Thank you. So that just brings us on to the forward plan, and 2 items on this. The first is a note from the informal discussions around learning disabilities. Mike, do you want to add anything on this?
Very, excuse me, very briefly, Chair. Yes. So after the informal meeting that you had in July, no, not July, in April, which I think people found was very useful. If you remember, Ian Baines convenes that discussion. A small group of the people who were in that room got together under Ian's chairing and have come up with a proposal. Well, basically, come up with a proposal that learning disabilities should be a bit of a theme for you this year as a group of people that have often been overlooked, not deliberately, but that's happened. So there are a proposal for 3 different bits of work to take place during the year, and Ian and myself and those group of people who are frontline managers and the commissioners of learning disability services will keep working on pulling that work together and bringing it back to you on a regular basis. I don't know if there's anything you need to add to that, Ian.
I think I'll probably just add, and it kind of follows on from the conversation we just had about the wellbeing strategy. One of the things that we're quite keen to do on the work, and I think it is that we will involve people with learning disabilities in shaping those pieces of work directly, and it will be very much focused on 3 very snappy words, which is about health, wealth and relationships, which were fundamentally the things that the voice of people with learning disabilities were saying to us that they have most concerns about.
Okay, thank you. That's great. And we also have the draft forward plan for the August meeting, which looks fairly full. Mike, is there anything to add to that?
I think the only thing to add, Chair, that I said that I would ask of the Health and Wellbeing Board is that when the Council's Cabinet considered the Burnt Bridges report, I think there was a view that the Health and Wellbeing Board would be the place for the homelessness and rough sleeping strategy to report into. So if the board agrees to that proposal, then Sharon and myself will work on building that into the programme for the year.
Yeah, I mean, I know we've got it down for the August one. Yes, so yeah. I think it was more specifically kind of the follow-up on the recommendations in the Burnt Bridges report as well. I mean, I'm assuming most partner organisations are aware of that, which is the serious case review into the deaths of 5 street homeless people in 2018. But if not, I'm sure we can share a link to that and probably include a summary of that in the item on the August meeting. But yes, because the recommendations so clearly cut across different organisations, we agreed that we should the Health and Wellbeing Board was probably the appropriate place to hold the accountabilities for ensuring that the recommendations are acted on. Okay. Right, I'm not seeing anybody else, so thank you. Sorry, Megan, were you trying to come in, or were you?
Yes, I've got my hand up.
Yeah, but you couldn't see it on the camera.
Right, okay, well, buy a new camera. No, seriously, picking up on this, I went to one of our scrutiny meetings last week, the week before, I can't remember, Mark, performance and strategy, and there was talk about the report that's been done on homelessness, etc., etc. What I wasn't clear about at the end was, how does this fit in with the report that's already been, you know, the report that told us we had all these problems? And I got a really enthusiastic comment back that lots and lots of things have been learned and they're going to be implemented. Not a complaint in any way, but it's over 2 years since this report first came, and we didn't look at it, we didn't know it was there, but it's over 2 years, and I'd be, you know, I don't want it to slow down. And if it's coming to the Health and Wellbeing Board, that's fine. But if there are other organisations like the council that really ought to make sure this has got right, I don't want it to get lost.
No, I think it's, yeah, no, I think can be reassuring on that. I mean, it went to Cabinet on Monday, and we had both a presentation on burnt bridges and the homelessness strategy, which incorporates many of the recommendations there. And actually quite a lot of the things were done, you know, the government provided kind of a lot of one-off money for some which was supporting homelessness during the COVID crisis. A lot of the ways things were done then reflected some of the lessons learned from that. The big challenge going forward, of course, is that there is quite a lot of one-off money in the system around this at the moment, and it's being sure that the different ways of working we want to make us sustainable with the budgets going forward. That's going to be part of the big challenge. Okay, are there any more questions or comments? Then can I thank everybody for your contributions today. I've got a feeling that, because I've lost track of which meetings we've had when, there were probably people that this was their first meetings in their current roles, like Sarah from the police, for example, and I missed that. I think there's been quite a few changes, and I'll make sure the next the next Health and Wellbeing Board meeting we just go through and make sure we're all up to date with everybody who's here. But thank you for joining us today, Sarah. I'm sorry I missed that earlier.